for any reports of side effects. And the vaccine was well tolerated with no unexpected safety issues identified. The most frequently reported adverse reactions were irritability or crying, pain at the injection site, sleepiness, loss of appetite, and fatigue. The reactions were usually mild to moderate, resolving within a few days of vaccination, and no serious adverse reactions were reported. As with all authorized COVID-19 vaccines, Health Canada has issued terms and conditions to the manufacturer, requiring them to closely monitor any emerging safety issues, including any cases of myocarditis and pericarditis. Health Canada and the Public Health Agency of Canada will continue to work with provinces and territories, the manufacturer, and regulators around the world to monitor the safety of the vaccine. And we know that this collaboration has been able to quickly identify even the very rare and unexpected side effects that we've seen. This authorization comes at a critical time in the pandemic as we progress through the seventh wave. And though children are less likely to experience complications from COVID-19, they can still get very sick. And children, like adults, can spread the virus. Emerging data also suggests that children with COVID-19, regardless of severity, can develop long COVID. And rarely, some go on to develop multi-system inflammatory syndrome in children, which has a very high risk of hospitalization. There have been many questions over the last few weeks as well about new vaccines targeting the Omicron variant. Health Canada received a submission on June 30th from Moderna for its bivalent vaccine targeting both the original strain of the virus and the Omicron BA.1 strain for use as a booster in people 12 years of age and older. In addition, Moderna has indicated it plans to study a booster dose for children under 6 years of age, targeting the Omicron variant and the original strain of the virus. Other manufacturers have also indicated that they plan to make submissions for bivalent boosters for adults in the coming months. However, it may take some time before they make submissions for younger children. And vaccine manufacturers typically first conduct trials in adults and adolescents and then extend the studies to younger age groups, and this takes time. It's still important to remember in the meantime that the vaccines used in Canada are very effective at preventing severe illness, hospitalization, and death from all strains of COVID-19, and are the best tool we have available to protect ourselves, our families, and our friends. Now that the vaccine is authorized, I'm sure everyone is anxious to hear how it'll be used, and Dr. New will be providing an update shortly. Thank you. Merci. Miigwech.
Bonjour, merci de vous joindre à nous.
Hello, thank you for joining us. I'd like to talk to you about Spikevax, Moderna's vaccine, and its use for children after 6 years of age. 1.7 million children in Canada are now eligible for this vaccination. Health Canada heard Moderna's presentation with respect to children of 6 months to 5. These are data from the clinic for children and those older, and this because of the millions of doses given in the world. There will be a primary series of Moderna Spikevax, which can be offered at 6 weeks of interval, 50 milligrams for children from 6 to 11 years of age. It seems that the immune response of children to this Spikevax was similar to those observed in people of 18 to 25. Clinical trials were performed while there was another variant in Canada. The efficacy for those 6 months to 5 years were during the Omicron wave. As for all clinical trials, children taking part were closely followed in order to note any secondary effects. There were no major side effects. For the most part, there was irritability, crying, pain at the injection site, sleepiness, loss of appetite, and fatigue. Reactions were mild to moderate and disappeared a few days after the vaccination. No serious undesirable side effect was noted. Health Canada has told the manufacturer
Inacuité,
to
y compris des
closely
cas de
follow
myocardite ou de
any
péricardite.
possible problems,
Santé
including
Canada et l'Agence
myocarditis.
de la
Health
santé
Canada
publique du Canada
and the Public
continueront de
Health
travailler
Agency of
avec les
Canada are
provinces et les
working with
territoires,
provinces and
le fabricant
territories
et
and
les organismes de
manufacturers
réglementation du monde
and
entier pour surveiller
regulatory
l'innocuité du vaccin.
organizations
Nous savons que
worldwide
cette
to
collaboration a
make
permis de
sure
cerner rapidement
that this
même des effets
vaccine
secondaires
is
très rares
safe,
et inattendus.
because we
Cette
want to be aware
homologation
of
arrive à un
even
moment
rare and
critique de la
unexpected
pandémie,
side
alors que nous
effects.
sommes au début d'une 7e vague.
We are
Même
at
si
the
les enfants
beginning
sont
of
moins
a seventh
susceptibles de développer des
wave,
complications de la
and
COVID-19, ils peuvent tout de même être très
children aren't
malades. Et
likely
les
to
enfants, comme
develop
les adultes, peuvent
bad
propager le
cases of
virus.
COVID, but they can
Selon des
still
données émergentes, les
be
enfants qui
contagious and
contractent la
propagate the
COVID-19,
virus.
peu importe la gravité de leur maladie, peuvent
People
développer la
who
COVID-19 de
get
longue durée.
COVID,
Et dans de rares cas,
even if it's
certains peuvent
not,
développer le syndrome
even if they don't have
inflammatoire
serious
multisystémique chez
symptoms,
l'enfant,
they can still get
associé à un
long
très haut risque
COVID
d'hospitalisation.
and are
Beaucoup de
therefore
questions ont
associated
été
with
posées au
greater
cours des
risk of
dernières semaines à propos des nouveaux
hospitalization.
vaccins ciblant le variant
There
Omicron.
are
Le
new
30 juin,
vaccines
Santé Canada a
targeting
reçu de Moderna une présentation
COVID.
concernant un vaccin
There
bivalent
was a
qui cible à la
presentation
fois la
by
souche virale
Moderna
d'origine
of a
et la souche
vaccine
BA1 du variant Omicron
that
pour une utilisation chez les
targets
personnes de
the
12 ans et plus.
stem cells of
L'entreprise
this
Moderna a aussi
illness.
indiqué qu'elle prévoit étudier
Moderna also
l'administration
said
aux
that
enfants
they
de moins de
want
6 ans
to
d'une
study
dose de rappel
uh,
ciblant la souche
the
d'origine du coronavirus et le
administration
variant
of
Omicron.
this vaccine
D'autres
and
fabricants ont
also
aussi indiqué qu'ils
discuss
prévoient
booster
soumettre des
doses.
présentations pour des doses
They
de
said that
rappel de
they
vaccins
intend
bivalents au cours des prochains mois.
to
Mais il pourrait s'écouler un
present
certain
on,
temps avant qu'ils
give a
en soumettent pour les
presentation
jeunes
on
enfants. Les fabricants de vaccins
bivalent
mènent
dose.
habituellement en premier les essais cliniques chez les adultes et les adolescents, puis
The
étendent leurs
first
études aux plus
trials were
jeunes,
on
ce qui prend
adults
donc un peu plus de temps.
and younger people, but
Il est
now it's
important
going
de
to be
rappeler
done
que les
with
vaccins
young
administrés au
children.
Canada sont très
Vaccines
efficaces pour
given in
prévenir
Canada
les
are
cas
very
graves,
effective
les
in preventing
hospitalisations
serious
et les
cases,
décès, et ce,
hospitalization
pour toutes
and
les
deaths,
souches
and
responsables
this
du coronavirus
for
responsable de la
all
COVID-19. La
variants.
vaccination demeure le meilleur outil dont nous disposons pour nous
Vaccination
protéger
remains the
et
best
protéger nos
way to
familles
protect
et
our
nos amis.
families and our
Maintenant
loved
que le
ones.
vaccin a été
Now
homologué,
that
je
the
suis certain que vous êtes intéressé
vaccine
à en
is here,
savoir
I'm sure
plus
you'll
sur
be
la façon dont
interested to
il
know
sera
more
utilisé.
about how it
Le
will be
docteur
used.
Nou va maintenant vous
Dr.
présenter sa
New
mise à jour.
will now
Merci.
give an update. Thank you.
Bonjour et merci, Dr. Bertillon.
Thank you,
Bonjour
Dr.
à
Bertillon.
toutes et à tous.
I'd like to
Vaccination is an
say hello
important
to
tool in
all.
our response to the COVID-19 pandemic, and it remains one of the most effective ways to protect against serious illness, hospitalization, and death from COVID-19. Given that some provinces have entered a summer wave, today's announcement on the authorization of a vaccine for children under 5 years of age is welcome news. A COVID-19 vaccine to protect young children has been long anticipated by many parents in Canada. Today's announcement provides parents and caregivers with a vaccine option to protect younger children in their care against COVID-19. The National Advisory Committee on Immunization, or NACI, has carefully reviewed the available evidence on the safety, efficacy, and immune response generated by the Moderna Spikevax COVID-19 vaccine, as well as the spread and severity of COVID-19 in children under the age of 5. NACI is recommending that a complete 2-dose primary series of the Moderna Spikevax COVID-19 vaccine may be offered to children aged 6 months to 5 years who do not have contraindications to the vaccine. NACI recommends at least 8 weeks between the first and second dose. For children 6 months to 5 years of age who are moderately or severely immunocompromised, NACI recommends that a primary series of 3 doses may be offered with an interval of 4 to 8 weeks between each dose. This is because people who are immunocompromised may have a lower immune response to COVID-19 vaccination. Infectious diseases like COVID-19 are unpredictable. Although younger children are less likely to get very ill from COVID-19, some can get really sick, including previously healthy children. Since Omicron became the dominant variant, more children have become infected, and the number of hospitalizations and ICU admissions of children under 5 years of age with COVID-19 has increased. COVID-19 vaccination in younger children will increase their protection against severe illness. Even if a child has been previously infected with COVID-19, vaccination is still important. While infection alone provides some protection, vaccination helps improve the immune response and can provide stronger and longer-lasting protection. For children under 5 years of age who have already had COVID-19, NACI suggests waiting 8 weeks after the start of COVID-19 symptoms or a positive COVID-19 test before beginning or continuing the primary series. This interval may be shortened to 4 weeks for children who are moderately to severely immunocompromised. At this time, NACI recommends that children 6 months to 5 years of age receive this vaccine 14 days before or after receiving a non-COVID-19 vaccine. This precaution will help determine if a side effect that may arise following immunization is due to the COVID-19 vaccine or a non-COVID-19 vaccine. There may be circumstances when it is necessary for a dose of this vaccine to be given at the same time as another vaccine, in which case a healthcare provider can help with decision-making. Based on provincial and territorial projections, there will be sufficient supply of the Moderna Spikevax vaccine for children 6 months to 5 years of age. The Government of Canada is working closely with provincial and territorial partners and understands they will be rolling out vaccination programs for children in this age group shortly. Please check your provincial, territorial, or local health authority website for information on when the vaccine will be available in your area. Starting a primary series now will provide some protection to these young children. It is also an opportune time to remind everyone to stay up to date with COVID-19 vaccines and the boosters recommended for them. While this authorization and NACI recommendations will come as a relief to many parents of young children, some may still have questions about vaccination. Parents and caregivers should speak with a trusted healthcare provider if they have questions. Information is also available on your federal, provincial, territorial, or local public health authorities' website. Thank you. Merci. Miigwech. Bonjour à toutes et à tous. La vaccination est un outil
Hello,
important
everyone.
dans le cadre de notre
Vaccination
intervention
is
contre la
a
pandémie de
very
COVID-19
important tool
et elle
in
demeure
dealing with
l'une des façons
COVID-19,
les
and it
plus
remains one
efficaces
of the most
pour se
effective
protéger
ways
contre une
to
maladie grave,
protect against serious
l'hospitalisation
illness,
et le décès
hospitalization,
attribuable à
and
la
death
COVID-19.
from
Certaines
COVID-19.
provinces étant actuellement aux prises
Given that
avec une
some
vague
provinces
d'été,
have entered a
l'annonce
summer wave,
d'aujourd'hui
today's
en ce qui
announcement
concerne
on the
l'autorisation d'un
authorization
vaccin
of a
pour les
vaccine for
enfants âgés de
children
moins de 5 ans
under 5 years of
constitue
age
une bonne
is
nouvelle.
welcome
Un
news.
vaccin contre la COVID-19
A
pour protéger
vaccination
les jeunes
against
enfants
COVID-19
est
to protect
attendu depuis
children has
longtemps
been
par de nombreux parents au
hoped
Canada.
for a long time by
L'annonce
many parents in
d'aujourd'hui offre
Canada.
aux parents
Today's
une option
announcement
vaccinale pour
will
protéger les
offer
jeunes enfants dont
parents and
ils prennent soin
caregivers
contre la
a vaccine
COVID-19.
option to
Le
protect
Conseil
children
consultatif national de
against
l'immunisation, au CCNI,
COVID-19.
a étudié
The
attentivement
National
les
Advisory
données
Committee on
probantes
Immunization,
disponibles
NACI, has
quant à
carefully reviewed the
l'innocuité,
available
à
evidence on the
l'efficacité
safety,
et à la réponse
efficacy, and immune
immunitaire du
response
vaccin Spikevax
generated by the
Moderna
Moderna
contre la
Spikevax
COVID-19, ainsi
COVID-19
qu'au sujet de
vaccine,
la
as
propagation
well as the
et la
spread and
gravité de la
severity of
COVID-19 chez
COVID-19
les enfants
in
âgés de
children
moins de
under the
5 ans.
age of
Le
5.
CCNI recommande qu'une
NACI
série
is
complète de
recommending
doses de
that a
vaccin
complete
Spikevax
two-dose
Moderna
primary series of
contre la
Moderna
COVID-19
Spikevax
soit
COVID-19
offerte
vaccine
aux enfants
may
âgés
be
de 6
offered to
mois à
children
5 ans
aged
qui n'ont
6
aucune
months to 5
contre-indication
years who
au
do not have
vaccin. Le
contraindications
Conseil
to the
recommande
vaccine.
également qu'une période
It also
d'au moins 8
recommends that at
semaines
least
s'écoule
8
entre
weeks
l'administration de la
be
première
allowed between the
et de
first
la seconde
and
dose.
second
Pour les
dose.
enfants âgés de
For
6 mois à
children
5 ans
from 6
qui sont
months to 5 years of
modérément à
age who
sévèrement
are mildly to
immunodéprimés,
severely
le CCNI
immunodepressed,
recommande qu'une
NACI
série
recommends
primaire
a
de 3
primary
doses
series
soit
of
offerte
3
avec un
doses
intervalle de 4 à 8
with
semaines
an interval of
entre
4
chaque
to
dose,
8
puisque les
weeks
personnes
between each
immunodéprimées
dose,
pourraient avoir
since
une réponse
immunodepressed persons
immunitaire plus faible
may
au
have
vaccin
a
contre la COVID-19.
weaker
Les maladies
immune
infectieuses
response.
comme la COVID-19 sont imprévisibles.
Infectious
Même si
diseases
les
like
enfants plus
COVID-19
jeunes
are
sont moins susceptibles
unpredictable,
de tomber
although
gravement
younger
malades
children are less
après
likely
avoir
to get very
contracté
ill
la
from
COVID-19,
COVID-19.
certaines peuvent
Some
tout de
can
même
get
être
really
très
sick,
malades, y compris les enfants en
including
santé.
previously healthy
Depuis
children.
qu'Omicron est devenu le variant
Since
dominant,
Omicron became the
plus d'enfants ont
dominant
été
variant, more
infectés et le
children have been
nombre
infected, and the number of
d'hospitalisations et d'admissions
hospitalizations
aux
and
unités de soins
ICU
intensifs
admissions
chez
of
les
children
enfants
under
âgés
5
de
years
5 ans
of
et
age
moins atteints de la
with
COVID-19
COVID-19
a augmenté.
has
La
increased.
vaccination des jeunes
COVID-19
enfants contre
vaccination
la
in younger children will
COVID-19
increase their
permettra
protection
de renforcer leur
against
protection contre
severe
une maladie
illness.
grave. Même si un enfant a déjà
Even if
contracté
a
la
child has
COVID-19,
already
la
contracted
vaccination est
COVID-19,
encore
vaccination
importante.
is still
Bien qu'une infection
important.
précédente offre une certaine
Even if
protection, La vaccination
feeding
améliore
infection
la
offers a certain
réponse
protection.
immunitaire et peut
Vaccination
offrir une
improves the
protection
immune
plus forte
response
et durable.
and can
Pour les
offer
enfants âgés de 5 ans
stronger,
et moins
longer
et qui
lasting
ont déjà
protection.
contracté la
For
COVID-19,
children under
le
5 years of
CCNI
age who
suggère
have already had
d'attendre 8
COVID-19,
semaines après le
NACI
début des
suggests waiting
symptômes de
8
la
weeks after
COVID-19
the start of
ou d'un
COVID-19
résultat
symptoms
positif à un test
or
de
a positive
dépistage avant
COVID-19
de
test
commencer ou de
before
continuer la
beginning or
série
continuing
primaire.
the
Cet
primary
intervalle peut
series.
être raccourci à 4 semaines
This
pour
interval
les
may be
enfants
shortened
qui
to
sont
4 weeks for
modérément
children who are
à sévèrement
moderately to severely
immunodéprimés. Pour le
immunocompromised.
moment, le CCNI recommande que les
For the
enfants
moment, NACI
âgés de 6 mois
recommends
à
that
5 ans
children
reçoivent ce
from
vaccin
6 months to
14
5
jours
years of age
avant
get a
ou après
vaccine
avoir
14
reçu un
days
vaccin autre que
before
celui
or
contre la
after
COVID-19.
having had a
Cette
vaccine
précaution
against
permettra de
COVID-19.
déterminer si un effet
This
secondaire
precaution
pouvant
will allow us
survenir
to
après
make
la
sure
vaccination est
that if
attribuable
there
au
is
vaccin
a
contre la COVID-19 ou
side
à un
effect
autre vaccin. Dans
that
certaines
happens after the
circonstances, il
vaccination,
pourrait être
after the
nécessaire qu'une
vaccination, it will
dose de
be
vaccin
because of the
soit
COVID-19
administrée
vaccine.
en même temps
In some
qu'un autre vaccin.
circumstances, it may be
Dans de tels
necessary
cas, le fournisseur de
that the
soins de
vaccine be
santé aidera le
administered at
parent
the
ou
same
le
time
gardien à prendre une
as another
décision.
vaccine.
En se basant sur les projections faites par les provinces et les
Based on
territoires
provincial and
de
territorial
Canada,
projections,
aura assez de doses de
there will be
vaccins
sufficient supply
Moderna
of the Moderna
Spikevax pour
Spikevax
les enfants de
vaccine
6 mois à 5 ans.
for children
Le
6
gouvernement
months
du
to 5
Canada
years of age.
travaille en étroite
The government is
collaboration
working
avec
closely
ses
with
partenaires
provincial and
provinciaux et
territorial partners
territoriaux et comprend qu'ils
and
lanceront
understands
sous
they will
peu
be rolling
des
out
programmes de
vaccination
vaccination
programs
pour les enfants
for
de ce
children
groupe
in
d'âge.
this age group.
Veuillez consulter le site web de votre autorité de santé publique
Please check the provincial,
provinciale,
territorial, or
territoriale
local
ou
health
locale
authority
pour
website for
savoir quand le
information
vaccin sera
on when
disponible
the
dans
vaccine
votre
will be
région.
available in your
Le fait
area.
d'entamer une série primaire dès maintenant
Beginning a
permettra
primary
d'offrir une
series
certaine
now
protection à
will
ces jeunes
offer
enfants.
protection
Il
to these
s'agit
young
également
children.
de bon moment
It's
pour
also the
rappeler
right
à tous
time
de
to
tenir à
remind
jour leur
everyone
vaccination contre la
to
COVID-19
keep their
et de
vaccinations
recevoir les
up to
doses de
date
rappel qui
and to
leur
get
sont
boosters,
recommandées.
those
Alors
boosters
que
that are
cette
recommended to
autorisation
them.
et les recommandations de
With this
CCNI
authorization and
représentent une
NACI
excellente
recommendations
nouvelle
will
pour
come as a
plusieurs
relief to
parents de
many
jeunes
parents
enfants.
of young
Certains pourraient
children.
encore avoir des questions
Some
au
may still have
sujet de la
questions about
vaccination.
vaccination.
Les parents et les gardiens devraient
Parents
discuter
and caregivers
avec un
should speak
fournisseur de soins de
with a
santé
trusted
de
healthcare
confiance
provider
s'ils ont des
if they have
questions.
questions.
De plus amples renseignements sont
Information is
également
also available
disponibles sur
on
les
your
sites web
federal,
des autorités de
provincial,
santé publique fédérales,
territorial, or
provinciales,
local
territoriales
public
ou
health
locales.
authorities
Merci.
website.
Thank you.
Thank you,
Miigwech.
merci, Miigwech.
Merci beaucoup. On va passer à la période des questions.
Thank
Donc,
you.
un
We'll now
rappel
go to
d'utiliser la fonction
questions.
main levée sur
You
Zoom
can
aux
use
journalistes. Là,
the
si jamais vous
raised
avez
hand
une question, un rappel qu'on va
function.
alterner entre
We
l'anglais
will
et le
alternate
français avec
between
priorité
French
donnée
and
aux membres
English
de la tribune de la
with a
presse.
priority
We will
given to
go to
press gallery
questions.
members.
A reminder to use the raised hand function if you do have a question on Zoom, and also a reminder that I will be alternating between English and French questions with a priority given to press gallery members. Alors, on va commencer avec Christian Noël de
We'll
Radio-Canada.
start with Christian Noël,
Bonjour,
Radio
monsieur,
Canada.
madame, merci beaucoup de prendre nos
Hello,
questions.
and thank you for
J'aimerais
taking
savoir
my questions. I'd
en
like to
quoi
know
vacciner les enfants si jeunes est nécessaire
why is it
pour contrôler la pandémie
necessary
et comment
to
ça
vaccinate
peut être
such
un
young
outil
children
pour garder
Is it a
peut-être
tool?
les écoles et les garderies ouvertes cet automne.
In order to keep schools and daycares open this fall.
Merci pour la question. C'est Dr. New. Peut-être je peux
Thank
commencer
you
aussi
for
à
your
passer la
question,
parole
Dr.
à
New
Dr.
here.
Berthiaume pour
I think I
ses
will ask
commentaires aussi.
Dr. Berthiaume
Moi,
to
je pense que
comment
c'est un
after
autre
me.
outil parce que la
I think it's another
vaccination,
tool
en
because
général,
vaccination
est
overall
des couches de protection
is
les plus
one
importantes
layer
contre la
of
pandémie.
protection,
Et jusqu'à
a
date,
very important
toutes
one.
les personnes au
And
Canada
this for everyone
admissibles
in
plus
Canada
de
who's
5 ans
eligible and who's over 5 years of age.
ont pu profiter
All these
des
people
vaccins
over 5
disponibles.
years of
Maintenant,
age
avec un
have
vaccin
been
aussi
able
disponible pour les
to
jeunes
take
enfants,
advantage of it.
on
Now
a
there
vu
is a
aussi à
vaccination
date
for very young
qu'il y a
children.
aussi, peut-être c'est moins fréquent que parmi les personnes plus âgées, mais il y a aussi
COVID
des
is
enfants
less
qui
frequent
se sont
among these
susceptibles à
young
des
children, but there
conséquences
are
graves et
children
même les
who
hospitalisations
are
et aussi
susceptible to
même
very
l'admission aux
severe
unités de soins intensifs. Donc, je pense que
symptoms
c'est très
and even
important aussi
hospitalization. I
d'offrir
think it's
un
also
vaccin pour
important
se protéger Et c'est quelque chose,
to
on est
help
aussi très
protect
content
them.
d'offrir aux
I think
jeunes
parents
enfants au
are
Canada.
very
Je pense
happy that
pour
we can offer
la
this to young
pandémie en
children
général,
in Canada. I think
si
that overall
la
the pandemic,
population en général, c'est le couverture vaccinale,
well,
aussi l'immunité en général
what's
est
important
le
is
plus
that
élevé que
the
possible. C'est
general
toujours mieux
immunity
pour toute
be
la
as
population
elevated
au
as
Canada.
possible
Donc, je vais laisser
for
comme ça
all
et je vais
Canadians. So I'll
peut-être
leave it
passer
at
la
that.
parole
And
à
now
Dr.
I
Bertium
will
s'il y a
yield the
des autres
floor to
commentaires.
Dr. Bertium for
Merci.
his comments.
J'ajoute, n'oubliez pas la portion de la
Yes,
question qui parlait de
I'd
garder les
like
écoles et les
to
garderies ouvertes aussi dans
add
votre réponse. Merci.
that it's especially
Merci pour votre
important
question.
for
Donc,
schools and daycares.
l'approbation aujourd'hui par Santé
Yes,
Canada du
hello.
vaccin Moderna pour
I
les
think
enfants
that the
de 6 mois à
approval
5
of
ans
this
offre
Moderna
une
vaccine
option de
for
plus
children of
pour
6 months
permettre
to 5 years
de
of
faire
age is
face à la
another
pandémie de la
option
COVID-19 au
to deal with
Canada.
the
Il y a
COVID-19
des
pandemic in
multiples
Canada.
avantages qu'on peut
There are
considérer si on
many
décide d'envisager la
advantages
vaccination
in
pour nos
considering
jeunes
this
enfants.
vaccine for our young
Essentiellement, comme le
children.
docteur Nou l'a
As
mentionné,
Dr. New
il y a une
mentioned,
diminution, on sait qu'il y a une diminution du
we
risque
know
d'infection, mais il y a
that there
surtout
is a
les
lower
bénéfices
risk
qui
of
sont bien
infection
connus de
and
la
also
vaccination, bien démontrés
benefits
là, dans les autres groupes
which we've
d'âge. C'est
seen
la
in other
diminution des
age
cas
groups.
sévères, donc les chances que notre enfant soit
It's
hospitalisé, les diminutions
far less severe
aussi de la
symptoms,
COVID longue
a
qui est
lesser chance of
associée au
being
fait de courir
hospitalized,
le risque
less
d'attraper
of a
la
chance
COVID.
of contracting
Les études de la
long
COVID
COVID.
longue chez les enfants démontrent que
A
c'est quand même
study of long
observé
COVID
assez
in
fréquemment
children
chez les
has
enfants.
shown that this is
Puis il y a
quite
aussi
frequently
le
observed in
syndrome
young
inflammatoire
children,
multisystémique chez l'enfant, qui est une
as well as
complication rare,
multi-system
mais qui va
inflammatory
entraîner, puis il y en a eu
syndrome.
plus de 400 cas au Canada
And
déjà
there
là,
have
chez les
been,
enfants de
I
0 à
think,
11 ans.
4 to
Puis
5
ça,
cases in
donc,
Canada among these
ça
very
entraîne
young
une
children.
hospitalisation, puis
This leads to
potentiellement des
hospitalization
complications
and
à moyen
potentially
terme. Donc, il y a beaucoup de bénéfices
complications
à
in the
considérer en
midterm.
plus
So there are
pour les
many
familles qui
benefits to
ont
be considered for
malheureusement
families who
là,
unfortunately
des enfants qui sont atteints de la
have
COVID-19. Ça a toutes sortes
children.
d'impacts sur aussi
It
l'organisation
also has
familiale,
impacts on the family
aussi les
itself.
risques pour les parents, mais
There
aussi
are
des fois
risks
quand
for
on vit, on est en
parents.
contact avec des personnes
And
vulnérables,
sometimes
que ce soit à cause
people
de
come into
conditions de santé
contact
des
with
adultes ou des
vulnerable
personnes
people
âgées.
because of
À ce moment-là,
vulnerable
ça
because
augmente
of health
le risque
conditions
au
or
niveau du
age,
cercle
and this
familial.
increases
Le fait d'être
risks in the
protégé
family
contre
circle
l'infection à la
and being
COVID-19 aide
protected
pour ça. La dernière chose que je
against
dirais, c'est
COVID-19 is a very good
c'est un
thing.
peu là, un défi lorsqu'une
It's a bit of
famille
a
est atteinte par la
challenge
COVID-19
when
parce
a
que
family
ça se
has
passe d'une personne à l'autre, ça
COVID-19
affecte
because
les
it goes from one
activités,
person to the
sociales,
next.
les activités
It
sportives,
affects
donc, puis
all of their
éventuellement les activités
activities,
scolaires
social
lors du retour à
activities,
l'école. Alors,
work.
c'est tous des bénéfices là, qui font que
So
les
there are
parents
many
peuvent considérer
benefits to
cette
the vaccine
option-là
because and benefits that would
comme
make it a
maintenant
good idea to
disponible là, pour
consider this
immuniser leurs
vaccine
enfants mieux contre
to
la COVID-19.
immunize
Merci.
their very young children
Merci.
against
C'est Dr. New
COVID-19.
encore pour
Thank you.
la question concernant
Dr. New
les
here
écoles et
again.
aussi les garderies. Oui,
With
je pense que
respect to
c'est
schools and
très important.
daycares,
Tout le monde
I think it's very
comprend que
important that everyone
c'est pas
understand
seulement
that it's
une
not
question
only
de continuer l'éducation comme des
about
pédagogiques pour les enfants aussi à
continuing
l'école, mais
school
aussi
for
c'est très
children,
important pour
but it's
leur
also
santé mentale,
important for
leur
their
développement
mental
social et
health
tous
and
les autres
social
bénéfices.
development
Donc,
to be at
on
school and
attend
in
aussi parce que
daycare.
avec comme on dit, l'élèvement des mesures de santé publique, on
With
voit aussi que les autres maladies
the
respiratoires
fact
commencent
that
à
there are
augmenter. Même
more
maintenant, le printemps aussi, l'été, on a
mandates,
eu
cases are
plusieurs cas
going
de la
up.
grippe. Donc, on attend pour peut-être
So
l'automne et
we're
l'hiver
waiting
avec le retour
for
scolaire
fall and winter, and
qu'on
when
peut
kids go
peut-être
back to
avoir plus
school,
des infections avec toute une gamme
may be
des
seeing
maladies
more
respiratoires.
infections with a
Et donc,
whole
si on peut se protéger
gamut
contre
of
la
respiratory
COVID-19, au moins c'est
symptoms.
une maladie comme une infectieuse respiratoire de moins.
COVID-19 is an
Il faut,
infectious respiratory disease,
c'est toujours un bénéfice comparé à des autres
and I think it's
infections
always
que les
a
enfants
good
peuvent
thing to be
attraper
immunized
à l'école.
against it. And there are other things, that
Merci
children can
beaucoup. En
catch at
suivi, si je peux
school.
me permettre, sur un sujet un peu
Thank you very
différent,
much.
c'est la
I'd like
reprise
to
aujourd'hui
follow
des
up with
tests
another
aléatoires à
question.
l'extérieur des aéroports cette fois-ci.
Um,
C'était déjà prévu,
in
ce n'est pas une
airports,
surprise. Mais la
and this
question
isn't
demeure,
a
pourquoi
surprise
est-ce que
of
le
what's going on
Canada
in airports, but why
continue de
is it
faire
that
ces
Canada
tests
is
aléatoires pour les
continuing to
vaccinés,
do these
obligatoires
random
pour les
tests
non-vaccinés, alors que
that
d'autres
are
pays dans le monde
compulsory for the
ne le font plus?
non-vaccinated,
Quelles sont les preuves
whereas
qu'on a
anyone
que
can
ça
get
nous
it? What
aide
is the
vraiment?
proof we have that this really helps?
Merci pour la question. Moi, je
Thank
peux
you for the
seulement parler
question.
pour le Canada,
I can
pas
only
pour les
speak
autres pays,
about
mais ici au
Canada, not about
Canada,
other countries, but here in
les
Canada,
dépistages aléatoires,
this
c'est
random
très
testing
important pour
is
notre programme
important
de surveillance, pour
for our
voir s'il y a
monitoring
peut-être
program
l'importation des autres variants, des
because
sources
other
préoccupantes au
variants may
Canada,
be
parce que
coming into Canada,
c'est très important de ramasser les
and
données
it's
probantes pour
important
informer les
to
autres
know
peut-être
about
recommandations
this
de la
in
santé
order to
publique. Ça, c'est
formulate
très
other
important.
recommendations.
Et c'est faire partie de
And this
aussi
is
ajouter à la base
part
des
of our
données
being
probantes
able
aussi
to add to
la
the
science à travers le monde.
base,
C'est
the
quelque
database,
chose
and add
si on
to
compare aux autres
various
pays, parce que le Canada, on a bien
pieces
fait
of evidence of what's
jusqu'à
happening.
date, que peut-être comparé aux autres pays.
Now, I
Mais
think
je ne peux
Canada,
pas
I
parler pour
can't
les
really
autres
say
pays.
compared to other
Seulement pour vous dire
countries,
que
but I will tell
si
you
on regarde, il y a plusieurs facteurs
that we
ici au
look at this,
Canada,
there
mais
are
aussi
various
dans les autres
factors
pays.
in
C'est
Canada and in other
l'épidémiologie.
countries.
C'est quoi la
And that is,
capacité, le système de soins de
what is
santé?
the capacity of
C'est
our
quoi la
healthcare system
couverture
to deal with
vaccinale
this?
dans
What
les
is
autres
the
pays? Ici au
level of
Canada, on a bien fait
vaccine
comparé
coverage
aux autres pays. Ça,
in
c'est très
Canada or
important
in
à
other
souligner.
countries?
Mais
I
aussi,
think
c'est
we have
aussi
very good
peut-être
vaccine
une
coverage
question
in
de
this
comme le
country,
seuil de tolérance des risques
but we
dans les
also
autres
have to
pays,
look at the
peut-être
risk
comparé au Canada.
tolerance
Je pense en
threshold.
général, on a fait
And
très bien parce qu'on est
I
très
think we're
prudent. Je
doing
pense
very well
que
because we've
tous
been
les
very
Canadiens, toutes les
cautious, and I believe
Canadiennes
all Canadians
comprennent bien qu'avec les efforts
understand that
collectifs à
with
date, on a bien
our
fait parce que si
collective
on regarde c'est
efforts,
quoi la morbidité
we're
et
doing
mortalité ici
well
au Canada
because
comparé aux
we
autres
don't
pays,
have the
je pense
levels
qu'on
of
a bien fait.
mortality and
C'est
morbidity
toujours une
observed
question
in
de
other
continuer
countries.
pour
So I think what we
protéger,
have to do is
pour se
continue
protéger aussi protéger les autres. Donc, je pense
protecting
qu'on va
ourselves
continuer
and
pour
others,
les
and we
raisons
will
que
continue
j'ai
on this
constatées.
path.
Merci.
Thank you.
On va passer à Dylan Robertson.
We'll now go to
Winnipeg
Dylan
Free
Robertson.
Press.
Hi there. I realize that you're not the procurement people, but does anyone on this panel have any indication of when these modified shots will arrive in Canada and how soon people will be able to actually get them?
So, Dylan, I just so I clear the question. You said modified shots, or you're talking about the Moderna vaccine that's just been approved today?
Yeah, because the release said it had to be 1/4 of a normal shot.
Okay, so it is a Moderna vaccine. What I can say is that, as I mentioned in my remarks, is that even as this vaccine's been authorized, obviously there's been work behind the scenes, and certainly we're in a good position. My understanding is that there will be enough available vaccine, and there will be distributed to the provinces and territories, so they can begin their programs to offer vaccination to this to young children in this age group very shortly.
Thank you. And a two-part question for Dr. New. I'm wondering if we're in a new COVID wave and how important it is for provinces to prioritize these shots for toddlers, given that we have so much going on now with the monkeypox vax, the forced shots, other public health concerns. When you're looking at the epidemiology, how should provinces approach the toddler vaccination, and are we in a seventh wave?
Well, thank you for the question. What I would say is that with respect, to a seventh wave or whatever number of waves we've had, I would defer the provinces and territories. And certainly I've seen that, for the province of Ontario, Quebec, people are talking about a seventh wave. I think it really speaks to the fact that we have to be humble. Our past experience has been that, during the summer, usually the activity of COVID-19 has decreased somewhat, and we are always bracing for the fall. But as you can see with the constant mutation of this virus, and what it's doing in terms of transmission and also maybe a vaccine escape, immunity escape, that we are in the midst, I would say, at least in several of the provinces, of a seventh wave. So that's important to acknowledge. The point about vaccination programs, I would say, starting with the adults, we've done well, but we could do better. The one thing that I think I would stress at this point is that it's so important for, I think, adults 18 years and over to have those 3 doses. We know that the primary series of the 2 doses is important for that baseline immunity, but we also know that immunity wanes over time, and usually by about 6 months or so, there's a demonstrable drop. And so getting that quote 3rd dose, I think, is key. There's still several million Canadians that haven't gotten that 3rd dose, even though we've done quite well. So I think we need to, as they say, up our game in that regard, so that we're better prepared for this ongoing 7th wave, but also for what might happen in the fall. And I think offering the vaccine to, as you said, this younger age group, I think is just part of that. I think it's not sort of one or the other. I think it's part of our comprehensive program that obviously the provinces and territories are rolling out with respect to offering COVID-19 vaccines across all of the eligible age groups.
Boris Proulx, Le Devoir.
Oui, bonjour. Je
Yes.
note que
Hello.
dans le CCNI, on recommande un intervalle
It
de
seems to
8
me that
semaines, mais que
NACI is
Santé Canada
recommending an
a
interval
trouvé
of 8 weeks, but
qu'un
Health
intervalle de
Canada
4 semaines.
has
Est-ce que je
talked
comprends
about an
bien
interval
que
of 4
la
weeks?
recommandation du CCNI ne
Now,
pourra pas être
is
appliquée par les
the
provinces puisqu'elle n'a pas été
NACI
homologuée comme telle
recommendation
par
not going
Santé
to be
Canada?
adopted by the provinces?
Oui, c'est Dr. New. Peut-être je peux commencer avec la
Dr.
réponse.
New
Je pense
here.
que c'est pas la première fois.
I don't think
Donc,
it's the first time.
je pense pour même les autres
I think
recommandations,
there are
il y a
other
toujours une différence
recommendations.
entre les
There are always
recommandations
differences
pour une vaccin homologuée par Santé Canada, selon les
among
données probantes des
vaccinations
essais
approved by Health
cliniques
Canada.
fournis par
There are clinical
les
trials
entreprises, les compagnies.
provided
Mais
by
avec
the company.
l'expérience dans
But
le
there's
monde
also
réel,
experience in the
on a
real
vu
world, and
qu'avec
we
un intervalle
observed that with an
plus
interval,
long, on
with a
a
longer
eu une bonne
interval,
expérience pour avoir une
it turned out
immunité
well,
plus forte et aussi durable
and it gave
pour tous les Canadiens
more immunity and
jusqu'à
more
date
lasting immunity.
pour les vaccins. Donc,
So,
avec cette expérience,
given
c'est
our
pourquoi le CCNI
experience,
a aussi
NACI
recommandé un
has
intervalle au moins
recommended
8 semaines. C'est
an
aussi
interval of
la
at
même
least 8 weeks.
recommandation
It's
pour
the
un
same
série primaire pour les autres vaccins,
recommendation
même pour les adultes.
for
Donc, je
other
pense que
vaccines, even
c'est
for
aligné
adult
avec ça, avec
vaccines.
les
So
mêmes
it's in
principes,
line with
mais on
this.
comprend bien la différence entre
But I do
l'intervalle
understand that
selon
there's a difference between
l'homologation,
what the
approbation de vaccin
company
selon les
recommends
données fournies par la compagnie et
and
avec
the
notre
interval
expérience collective
that
ici au
we
Canada. Et je
have
pense que
established given
les
our
provinces et
experience in
territoires
Canada. I think that the provinces and territories
sont prêts à peut-être
are
plus suivre les
ready,
recommandations de
perhaps to
CCNI,
follow
aussi
NACI's
avec leur
recommendations,
expérience avec les autres
given
vaccins.
their experience with other
Merci
vaccines.
pour la réponse.
Thank you. Thank you for the answer.
Dans vos documents et
In
dans vos
your
discours, on parle
documents
beaucoup
and
de
in
protéger
your
les enfants contre
when you talk about
différentes
protecting
conséquences de
children
la COVID.
from
On parle
the
pas beaucoup de protéger
repercussions
les
of
autres cette
COVID.
fois-ci.
We also
Et
talk
je note que
about
dans vos documents
protecting
de
others.
préparation, vous
In your
parlez pas non plus de
document,
baisse de transmission, par exemple, de la COVID-19 pour
you don't talk
des
that
enfants,
much
des tout petits
about
qui
the
seraient
propagation of
vaccinés. Est-ce que vous avez quelque chose
COVID-19.
à dire sur si
Do you have anything to
ce
say
vaccin
about
pour
this,
bébés ou jeunes enfants serait
a
fait pour
vaccine
réduire
for
la
babies and
transmission?
young children in order to
Oui, peut-être je peux commencer, mais aussi
stem transmission of the
laisser
disease?
donner la parole aux autres.
Well,
Peut-être pour commencer, on
I
voit
think
qu'on est
I
toujours en
would
train
say first
d'apprendre
that we're always learning,
et ajouter à nos
and
connaissances
we're always
concernant la
adding to
COVID-19.
our
Avec
knowledge about
ce virus, c'est
COVID-19.
vraiment, comme on dit,
And
un
as
virus qui continue à
has
évoluer
been
avec les
said,
mutations.
it's
Donc, on voit maintenant avec les variants
a virus that's constantly evolving and has
il y a
variations.
un aspect, comme on dit, de l'immunité que les vaccins ne sont pas capables de prévenir l'infection. Donc, on sait la chose peut-être la plus importante, c'est la protection contre les conséquences graves. Donc,
against the more severe consequences of COVID.
contre les
I'd
conséquences
also
graves,
like to
contre
underscore
l'infection, parce que c'est possible que ce vaccin aussi avec les
because
autres
this vaccine,
sont moins efficaces contre l'infection, mais
there are
c'est toujours
some
avec l'évidence de
vaccines
date,
that are
pour les
perhaps
adultes, on
less
voit qu'avec les 3 doses,
effective
ça
against
offre une très bonne
infection
protection contre les
with one dose,
conséquences
but
graves.
with 3
Mais peut-être
doses,
passer
this protects
aux autres pour
really
leurs
well
propres
against
commentaires.
severe forms of
Oui,
the
je vais peut-être
infection.
complémenter votre réponse, Dr.
Yes, I think
News.
in order to complement what you said, Dr. New, I would say
chez les enfants de 6 mois à 5 ans,
that
c'est qu'il n'y a pas
vaccines for
de
children of
données
5 months to 6 years of
spécifiquement à ce
age
groupe d'âge-là sur la réduction de la transmission de la
will help to
COVID-19.
reduce transmission
Cependant,
of
on a des
COVID.
données qui
Nevertheless,
suggèrent
we
que
have
c'est quand
data
même
that
efficace pour prévenir
suggests that it helps
un certain nombre
to
d'infections
prevent
symptomatiques, même pour le
certain
Micron. Ce qu'on sait aussi, c'est que chez d'autres groupes
Omicron
d'âge,
infections as
il y a
well.
eu des études
For
qui ont été
other
faites, par
age
exemple,
groups, there have
chez
been
des
studies
professionnels de la
done
santé ou des gens
by
dans
healthcare
différents groupes d'âge. On a pu
professionals
démontrer
on
que les
different
vaccins, de
age
façon
groups,
générale,
and
avaient un
vaccines
impact sur la
have
transmissibilité de la
overall
COVID-19
an
en
impact
diminuant
on the transmissibility of
le
COVID
nombre d'infections, puis aussi des fois
and
la
on the
charge
number of
virale qui est
infections, and
excrétée
even
par
on
les
the
gens qui font la
viral charge,
COVID-19.
the viral
Donc, sur cette
load.
base-là, on peut extrapoler que dans ce groupe d'âge-là,
So we have
on pourrait
extrapolated that in
s'attendre
certain
à
age
un
groups, we
impact
can
sur,
expect,
on pourrait espérer une diminution
or
de
at
la
least we can
transmission. Elle est probable
hope
sur la
for
base des
an
données qu'on a
impact
dans d'autres
on on the infection rate, but we cannot affirm this beyond any doubt at this point in time. But as I said, we can project, given the data about various age groups and about the potential benefits of vaccination for these age groups. Thank you.
Ryan Tumulty, National Post.
Yeah, hi there. I wanted to ask about fourth doses. A number of provinces are expanding eligibility to that, but some are also still suggesting that not everyone needs to take that step. Do you have any recommendations, Dr. New, on how people should approach a fourth dose?
Well, thank you very much for that question. What I would say is that, we've said this many times, is that, Canada is such a large country, and the epidemiology from one coast to another coast varies. And so what I think you're seeing is that the provinces obviously have a better handle in terms of what's actually happening on the ground with their quote local epidemiology, be it at provincial level or even at a city level, are in the best position to know what the sort of the state is in terms of circulating virus and what the risks are for individuals. What I would say is that generally, as I've mentioned before, I think everyone would be agreed that based on the science that everyone is aware of, that getting 3 doses to everyone who's eligible, I think, is the key. There's still obviously some work to do, but we're doing quite well. So let's push on the 3rd doses. What we've also seen from the science is that certainly those at highest risk of severe consequences, let's say the elderly or people who are immunocompromised, especially if, let's say, the time that's lapsed since their last dose, be it a booster or even the primary series, has been more than 6 months, and certainly it's a good time to get that additional dose to protect. Obviously, depending on your personal risk factors, what kind of activities you might be undertaking, and obviously, with other recommendations from local officials. So that I think would be the general sort of approach. But certainly, I don't think there's a one size fits all, and I think the most important thing is for individuals to listen to local public health authorities.
Yeah, maybe
Dr. Tunis, I'm not sure if you'd have maybe any additional points.
No, I think that's a very complete response.
Maybe I'll ask my follow-up in a slightly different way. Is there a downside to people who, aren't in any of those targeted older age groups or immunocompromised? Is there a downside to getting a 4th dose, even if all they really want it for is an extra level of security? I know Canada has plenty of doses available.
It's Dr. New. I think there's probably a lot of opinions out there, even within the scientific community. I would say that if someone were to get a 4th dose, certainly I think it's recognized from what we know from the science that it would be a sort of a temporary or for whatever period of time a boost in terms of the antibodies, but that would wane with time. And what I think is also, I think in many ways, adding to the complexity of the issue is that many individuals have also been infected with COVID-19, the Omicron wave, et cetera. And so we also know that having a sort of what we call natural infection also confers a certain level of immunity for a certain amount of time. So with all that in play, in terms of being a sort of a protected immunity solely from vaccines, or what we might call hybrid immunity, a combination of having a certain number of doses of vaccine as well as maybe being infected with COVID-19, how that plays in terms of someone's thinking about whether they could or should get a 4th dose. I think if they're in that position, they've already had the 3 doses and maybe they've even been infected, I say, hey, you're doing quite well, and let's maybe put the push on for those individuals who haven't had their 3rd dose of vaccine. The only other point I would make is that why we keep stressing about the 3 doses is that from what the science has shown us is that certainly with vaccination, it's a more controlled way of getting your immunity up, as opposed to, quote, relying on natural infection. We know that people have been sometimes even reinfected, a number of times, and there's some early evidence, and we're certainly tracking that in terms of some of the long-term consequences, long COVID, and so on. And certainly, I think it's better to get vaccinated and depend on the vaccines for your immunity rather than sort of getting multiple infections, because there's certainly some evidence to show that there may be some longer-term consequences. I would also defer to my colleagues if they have additional comments.
I mean, Dr. Tunis here, I could add, we've heard some discussion about the new formulations, and that's, I think that is something that we understand is coming up as a question. One of those has been submitted to the regulator, and NACI is reviewing in parallel to the regulator about these potential new bivalent booster formulations. They're certainly not available now, but could potentially become available sometime in the coming months if there's a positive regulatory decision around those. So that is part of the challenge, is that we're talking about program transitions now, and we maybe are in a transitional phase between ancestral boosters and possibly moving towards new formulations. It's a very dynamic space, but the authorized products that are available now to individuals are the ancestral products that have been shown to demonstrate good protection. So that's one element of complexity also that's added into this mix. But NACI is reviewing very actively along with the regulator on those new formulations.
Okay. Raymond Filion, TVA.
Raymond Filion.
Merci, bonjour.
TVA.
J'aimerais simplement savoir s'il y aura
Thank you.
éventuellement un
Hello.
vaccin
I'd
pour
like
les
to know
moins de
if there
6
will
mois.
be a vaccine one day for those under 6
Je vais
months
prendre
of age.
cette réponse-là.
Well, I'll answer
Actuellement,
that.
à ma connaissance, il n'y a pas
At the present
d'études là,
time, to my knowledge, there
dont
are
on a
no
été informé qui vont nous
studies
être
we've been
soumises pour
informed
les
of
vaccins, pour un vaccin chez les
on
enfants de 0 à 6
vaccines
mois.
for children
Et vous, est-ce que vous
under
pensez
6 months of
que
age.
ça vaut la peine? Ça vaudrait
Do you think it's
éventuellement la peine de
worthwhile? Do you
vacciner
think
les
it
moins de
might
6 mois?
eventually
Ou 6
be
mois, ça passe trop
worthwhile
vite?
to vaccinate children
C'est une bonne
under
question.
6
Je
months of
pense que pour
age?
les 0 à 6 mois,
Well, that's a
un
good question.
des
I think
enjeux
for these children,
pourrait
one
être
of the
théoriquement
issues
une
might be
transmission par le lait
hypothetically
maternel des anticorps de la mère à l'enfant qui pourrait
transmission
affecter, par
of
exemple,
a
qui
mother's
peuvent en partie
antibodies
protéger
to the
les
child,
nourrissons, puis
and
qui
this
pourraient
might
affecter
well
la réponse au vaccin. Ceci dit, il faudrait faire des
immunize
études
a
là-dessus.
newborn,
Donc,
but
c'est difficile
studies
pour
will
moi,
have to
là, en
be
l'absence
carried
de données,
out.
de dire
I think in
s'il
the
y aurait des
absence of
bénéfices. Il
data,
faudrait les
I can't really
étudier. En
say if there
théorie, il
would
pourrait y
be
avoir des
benefits. It would
bénéfices,
have
mais
to be
en pratique, il pourrait y avoir aussi des
studied.
spécificités là, à ce groupe
Hypothetically, there
d'âge-là qui
could
pourraient
be
faire
benefits,
que ça pourrait être différent d'un groupe d'âge plus
but
âgé, particulièrement si on pense,
it
comme
might
je le
be
disais, là, à la transmission chez les
it could be
enfants
different.
allaités des anticorps
There
maternels.
are
Merci.
all these factors to take into consideration.
We'll go to Laura Osman, Canadian Press.
Good afternoon, doctors. Thanks for taking our questions today. I wanted to talk about the NACI recommendation. The standard language is that the vaccine may be offered. As a mother of a 2-year-old myself, that doesn't necessarily speak to me. I'm wondering if someone is able to kind of translate that into what NACI really means in terms of advice to parents.
Yeah, it's Dr. New. I think I would turn to Dr. Tunis right away. There's sort of a very sort of scientific approach and very, very careful use of the language that NACI has used historically, which obviously has been the case for COVID-19 vaccines to date. And I don't think they've strayed from that. Certainly at the beginning, when you make a recommendation based on sort of just based on the available clinical data from the trials and so on, they make a certain type of discretionary recommendation. And that as more real world data comes in, then based on that they might be making a stronger recommendation. But I would turn to Dr. Tunis to expound on that further.
Yeah, that's correct. We've seen a pattern throughout the pandemic with the pediatric vaccines where, while there are risks, the risks are lower than with older adults. And so as those new pediatric vaccines are introduced, the committee has been starting with a may be offered recommendation where, where the evidence may be closely balanced, and the committee is waiting to see further evidence accumulate that would inform the need for these doses in the pediatric cohort under 5, and as we learn more about the vaccine. But certainly the committee is recommending that they may be offered, and is acknowledging that this could be an important protective measure for many parents and of those children that would want to exercise that option, and for the children themselves. So it's that the may and the should language from the committee is really designed to inform the provinces and territories and the healthcare providers in how to understand the evidence and how to interpret that volume of evidence that's available and think about how that might evolve. So I think really for any parent who's thinking about the decision and is wondering what this means and how to interpret that evidence, I think that's a lot to ask, an individual parent, and the best place to have that discussion is with a healthcare provider and or with your local public health unit if you are, going to seek a vaccination there. So it's a standard approach that we've seen the committee take, with the 5 to 11 vaccine, and additionally with the 12 to 17-year-old boosters as well. When those became available, the committee started with a may be offered, and then as evidence evolved, and the level of risk and the level of benefit that can be conferred by the vaccines becomes more clear over time, then that potentially may change. But at this point, they're using their standard approach, which is to introduce this vaccine into the environment as an additional tool, an additional option for parents and for the community to use for protection.
Appreciate that. Thank you. And Dr. Howard-New, obviously the uptake for kids 5 to 11 has been a lot lower than that in the general population. The risk-benefit analysis for parents is different with their young kids who, as you mentioned, are at a lower risk of severe illness. So what is the public health agency planning to do, and what should parents be thinking about in terms of sort of combating that hesitance to get this vaccine? And is that maybe a reasonable thing to do at the moment as we wait for more evidence to come in?
Well, thank you for that question. I think certainly not only for this vaccine and for this age group, but in general, one of the things we certainly would like to do is get as much information out there so that parents can make an informed decision. I think it's so important. It's not something that we're forcing on anyone, but it's certainly that we want to make sure that the parents are comfortable. And so it's not a matter just of, quote, providing information that maybe parents can access, be it on a website, but also to support the frontline healthcare providers, because if they have the tools and the information, then they obviously, as a trusted source of information, they can have those discussions with the parents, and then at the end of the day, everyone is comfortable with whatever decision is made. So I think that's how we're intending to support, but certainly that's in conjunction with whatever efforts are being done at provincial and local level.
And we will finish with Jamie from Global News, I believe.
Hi, all. I just wanted to play off that question just a little bit more. So the experts we spoke with today, the infectious disease experts and pediatricians, say that the decision should be made on a case-by-case basis, that not all families, the vaccine won't be right for all families. Is that something you agree with, just to be really clear?
Yes, I wouldn't disagree with that. Certainly, it's like we've mentioned another tool. I hate to say this expression, another tool in a toolbox. It's another option for families, for young children. But I think it's so important that parents have to feel comfortable. And certainly, I think we mentioned in our remarks that I'm sure there's lots of questions. And please speak to your healthcare provider, your trusted source, be a family physician, a pediatrician, to get the right information, but also have that good discussion, because it really is it's a back and forth, not just kind of a one-way street in terms of giving information. Then it's up to the parent to figure it all out. So yes, I would certainly support a good conversation. And if there's anything we can do, certainly we work with the professional organizations, with the pediatricians and so on. And certainly we want to make sure that they're well supported with the kinds of information tools they need to have those, quote, informed discussions with their patients.
And my second question is actually about monkeypox. Since cases have risen pretty rapidly here in Canada, do you feel like the general public should have a reason to be more concerned at this point?
Well, I think my general take is that in general, people need to be aware of monkeypox and how it's spread. And I certainly, from the evidence and what we've seen today with the epidemiology, it really requires a certain type of close, intimate contact, physical contact from someone who is infected with monkeypox, with the lesions and, maybe, bodily fluids. And so for the general public and even those who are maybe at increased risk, if people understand what kind of activities would put them at greater risk for exposure to the monkeypox, then that's certainly, I think, what people just need to be aware of. I wouldn't say that for, quote, the whole general population, we need to be concerned to the same degree, let's say, compared to COVID-19, because certainly it's not as transmissible. It's certainly not spread in the same way as COVID-19. But people need to be aware of the mode of transmission and what we're doing is looking at the epidemiology and working closely with our provincial and territorial counterparts to make sure that both from a sort of a vaccine perspective and making sure that the vaccine is available and offered to those at highest risk, but also working with the communities, because we recognize it's not the vaccines alone that's going to manage and deal with monkeypox. It's also making sure people understand there might be behavioral changes or certain activities that people should be aware of that would put them at greater risk. So certainly it's also an education aspect there as well, in addition to the vaccines.
All right, so that's all the questions we had. A big thank you to all the doctors for your time and for answering questions. And this ends the press conference. Ceci met fin à la conférence de presse. Merci encore au docteur pour votre temps pour avoir répondu.
This ends the press conference. Thank you again, doctors, for your...
Au revoir. Merci. Thank you.